Thank you so much for joining us today for the Positive Child Experiences. So at this time, I am pleased to introduce you to our speaker for today. Please welcome Ms. Candace Alley, founder and CEO of Trauma Resource Network.
Hey everybody, welcome. Thank you so much for allowing me to come and speak to you folks today. Hope and positive childhood experiences is something that's very, very near and dear to my heart. And Tufts University actually presented me with the honor to come and talk to you folks today. I'm asking for folks to sign the sign-in sheet just because we do have a facilitator form that is asked of folks to fill out afterwards, just to share your experience for research purposes. I promise you won't be spammed with anything, but I also do have some really cool informational sheets, but did not print them out because I had no idea how many, and I would have felt really funny if I would have brought 10 and there's like 30 or 40 of you in here. So I just thought, well, I'll send those via PDF if folks want to provide their information. So if you don't feel comfortable providing your information, that's absolutely okay. We won't hold it against you. But if you could, it would just benefit the research end of things because Tufts will end up with that information about the presentation, what you thought of it, those kinds of things. And then I'll be able to provide you with some additional information. As you can see on the screen, this is me and the organization that I founded. These are some of the things that we do. In addition, in the Orange County community in North Carolina, we also work hand in hand with other organizations and specifically with trauma survivors, namely women of domestic violence who have small children. We do a lot of support groups online for folks that don't necessarily have transportation or a means to go into an office, so we provide a lot of online support as well. And that's just a little bit about us and what we do. So here on this slide, you will see a photo, and I just want you to think for just a second, what stands out in your mind when you see this photo below, or on the screen, sorry. Yeah, nobody's together, neglect, disorganization, safety hazards, isolation. Yeah, lots of things going on here, isn't there? So specifically, were the risk or the protective factors easier for you all to see? Risks. And that's normal. That's how we're conditioned to think. That's called type 1 thinking. That's our intuitive thought process. That's kind of how we've been conditioned by society and the thoughts that we see every day. Those are the types of things that come to us first, even in our subconscious mind. Type 2 thinking is a little bit deeper. We have to consciously think about things to notice those. But what Tufts University is hoping to do is to really make the positive experiences for children be the intuitive thoughts that we think versus always pointing out the bad. Because what we found is there actually is value to that. So as you can see, implicit biases, those kind of things, and we all have them. Like there's nothing wrong with that because we all as human beings have them. It's our reaction, which again grows from cultural and personal biases that our brains processed over many, many years of just the way we do things in our world today. So slowing down our thought process and really being conscious and thoughtful of how and what we're thinking is where the type 2 thought process comes in. And that's when we get to where we want to start spreading hope. These folks that you see on the screen are the folks at the Hope National Resource Center. Our organization is also a Hope Champion organization, which means that we have gone through extensive training to be able to provide organizations and service providers with hope-informed consultations, We help them make their websites more hope-informed, their intake forms, their any kind of forms that an organization may use. We work to make those more hope-informed, and believe it or not, there's a lengthy process to that. It may sound a little weird just to hear it said, but it's an extensive process that goes into that kind of thing. And these folks at Tufts University are all the people that have made that possible. And so now I'll introduce you to hope and why hope exists. Hope exists because positive experiences do actually help children grow to be more resilient, to be more active a lot of times in their communities, and just to be happier, healthier adults is what the research that has been done shows. And we actually have some statistics that we'll get into in a few minutes about that. Hope is actually grounded on the core assumption of science of the positive from Jeff Linkenbach at the Montana Institute. And what he states is that the positives exist, it is real and worth growing. And we know that from positive experiences, it promotes children's health, their well-being, allows them to form strong relationships and connections. It helps cultivate positive self-worth. It helps provide sense of belonging. And it also helps to promote resilience. And so many of our systems really focus on the negatives, including the screening tools and different things. We always want to know, what are the issues that you have, or what are the problems that you're coming in for, rather than really focusing on the healthy outcomes from the positive experiences, which really kind of shifts the narrative and helps us define the strengths as well as the challenges that people may be facing. Children, parents, whomever it is that you serve in your organization. So, how much do you know about positive childhood experiences? Has anybody heard of them or studied them? Awesome. So that science is a lot newer than the adverse childhood experiences. So we're just really, really getting into the science of the positive childhood experiences. And what I kind of want everybody to think about while we're here and just kind of hold in your mind while we share time together today is, what is a positive experience that stands out to you from your childhood? And just hold that in your mind as we go through the presentation. Developing childhood experiences was part of a test, or a survey rather, that's done across the United States. It's part of BRFSS, I always forget those acronyms. And it started in Wisconsin back in 2015. And what they actually did was they took, it was Dr. Peter Pecora, Jennifer Jones, Bart Kilka, Jeff Linkenbach, and Dr. Robert Siege at the Hope National Research Center. They sought to better understand how the positive childhood experiences correlated with adult health once children grew up and became adults, and how that really related to that, much like we did with childhood experiences, or Kaiser Permanente actually did with childhood experiences adversity back in the 90s. And what the team did was add 7 questions about different types of childhood experiences that were positive to the Wisconsin Behavioral Risk Factor Surveillance System survey. And that's where that BRFSS comes in. And it's a telephone survey that is conducted all over the United States. This particular study focused on about 1,700 studies that happened in Wisconsin. And these are the 7 questions that you can see on the screen. Do they feel able to talk to your family about your feelings? Feel your family stood by you during difficult times? Enjoy participating in community traditions? Feel a sense of belonging in high school? Feel supported by friends? Have at least 2 non-parent adults who took genuine interest in you? And feeling safe and protected by an adult in your home? What they found was that children with 0 to 2 positive childhood experiences, only about half of them had good mental health as they became adults. And as the positive experiences went up, so did the positive mental health experiences throughout the lifetime. Very much in correlation with what we found to adverse childhood experiences. And what they actually did find was that they can offset each other slightly. And different ways that that the positive childhood experiences actually affect adults are resilience and actually health outcomes. So better mental health, but also less high blood pressure, less diabetes in some cases. But high blood pressure was really one of the big ones. But mental health was really the biggest of all that was focused on, and how it really made a difference in the more positive a child's life was versus one that was full of adversity. How much do you all know about adverse childhood experiences? I'm sure a lot more folks know about those. It's been around a lot longer. So in 1998, the study started in Southern California, primarily of folks that Kaiser Permanente. It was they were employed in Southern California. They answered questions about their childhood, and it correlated with both their physical and mental health. And then the positive childhood experiences, again, didn't come until 2015 and was part of all of that we discussed just a moment ago. And adverse childhood experiences come from abuse, it comes from neglect, it comes from various household challenges, like substance misuse, mental illness, divorce, intimate partner violence, and then the neglect, as you can see, can be both emotional or physical. And this just shows you a little bit about how adversity has a lasting impact on individuals throughout their lifetime. It can affect, it can cause traumatic brain injury, your mental health, as we discussed, even maternal health, infectious disease, chronic disease, risky behaviors, and even the opportunities that one will have later on in their life. And so what we have seen is in adverse community environments, there is also a correlation with the adversity that happens at home. So this tree is by Dr. Wendy Ellis and Dr. Bill Dietz at the George Washington University, and it actually adds to the social effects, including poverty, institutional racism, historical trauma, the effects of war, migration, and just various neighborhood effects and roots that most ACEs are kind of rooted in. And this understanding takes into account the reality that our ACE scores result from systemic and institutional racism outside the control of an individual family at times. We consider, like in the United States, for example, the experience of an incarcerated relative, which reflects the mass incarceration of young black men in the United States, while having an incarcerated parent would give a child an ACE score of a 1. The root of that score can be attributed to institutional racism more than even attributed to a deficit stemming from a particular family. And unfortunately, that's the sad reality we live in. There are building blocks for hope. There's 4 of them. And it's relationships, environment, engagement, and emotional growth. And what we found is that these 4 building blocks describe the key types and sources of the various positive childhood experiences that are really critical for the development of children. And as you can see, childhood abuse and neglect really disrupts the foundational relationships and safe home environments. And then family disruption disrupts safe environments, and then the community environments reduce engagement and opportunities for emotional growth. So it becomes kind of a roller coaster or kind of a snowball effect. Positive childhood experiences actually mitigate adverse childhood experience effects. And this is what I was talking about earlier, how they kind of offset each other. So the protective nature of the positive childhood experiences remain even in the presence of adversity. So adults who reported 4 or more ACEs or adverse childhood experiences, when they were exposed to an increasing number of positive childhood experiences, the rate of depression and poor mental health is actually reduced. And this actually exemplifies the protective nature of the positive childhood experiences. Research indicates that the absence of positive childhood experiences may be more damaging to the long-term outcomes than the presence of adverse childhood experiences. Does anybody disagree with that? Positive childhood experiences actually help to prevent the adversity. They help to block toxic stress and promote healing, in fact, and help with all of the resilience and all of that we discussed. So if we let that sink in for a minute, positive childhood experiences protect adult mental health, even in the face of adverse childhood experiences. What does that mean to you? So if 3 or 4 people just want to share what it means to you, I'd be happy to have you all share. Please.
I think it's very hopeful.
Hopeful?
Yeah, we've all been reading about ACEs, going to conferences about ACEs for a long time, and it can feel like, oh dang, well, here we have all these children and adults who have this high ACEs score. Wow, like throw up your hands, what are you going to do about it? But this is very hopeful.
Yeah, so she was just sharing that this is a very hopeful message, that we've all heard about adverse childhood experiences for decades now, and it was just kind of a bummer feeling, and this really instills, a hopeful type thought process. Anybody else? Yeah, so like she's saying enrichment programs and how colleagues that are doing enrichment programs, and it's oftentimes seen as an outside experience to the education system. Is that what you're referring to? Health and well-being, education, all of that, and how this really shows that maybe it should be included and we should be more inclusive of that. And I think that's a great point, because that's absolutely true. Anybody else want to share?
I think it shifts the focus to being strengths-based, where there are so many families that really are doing the very best they can and trying to get ahead. And just because they faced some challenges and had some struggles and trauma does not mean that's the end of their story.
Absolutely. Yeah. And I think for all of us here, what this really tells us and kind of shows us is, like you were saying, just because a family has experienced trauma and adversity doesn't mean that it can't be turned around, doesn't mean that things can't get better. And I think that's the beauty of all this, because the positive experiences do kind of not necessarily negate, but they kind of offset the not so great experiences. So the 4 building blocks and more about them. So it helps relationships with other children and other adults through interpersonal activities. For the environment, it creates a safe, equitable, stable environment for living, for playing, for education. Social and civic engagement, it helps develop a sense of belonging and connectedness. And with the emotional growth, the playing and interacting with other peers and self-awareness. So with relationships, it really helps children to be able to communicate better with other children. It helps them to be able to interact with them in a more positive way. Whereas a lot of times children that face a lot of adversity don't really sometimes know how to share and different things, as you all know. And so the experience of the positivity really kind of makes a shift and helps kind of change that outlook. And when we're talking about stable environments, it really makes them feel safer. It makes them feel like there's that sense of security that they may have been lacking in the face of adversity. And so when you can help parents foster that, especially after being in the face of adversity, it's incredibly important. And the science shows how helpful it is to really create that safe space in their environment. And then we have the engagement. Again, children that experience positive childhood experiences are able to engage more with people at many levels simply because they have a sense of belonging and connectedness. They don't necessarily feel so alone, whereas maybe they did in the past. And then emotional growth. It really allows them to get a sense of self when they have these positive experiences, whereas a lot of children that go through adversity may not experience that because their brains stay stuck in survival mode, and they may be stuck in fight or flight response most all the time. So this is really just a moment to sit and reflect on everything that we've kind of talked about, and to really think about how the positive experiences really can make a difference in people's families, children's lives, adults' lives. It can make a difference in everyone's lives. And so for me, when I learned about hope and the positive experiences, I found that it really gave me a sense of heartfelt joy, because I realized that we didn't always have to focus on the adversity, and we could, in fact, focus on the healthy experiences that children face, and that it would actually be beneficial in doing so. And so there are hope-informed resources and referrals that you can get to. And so these are a couple of the questions that we ask at Hope. How does your community define the building blocks? And how do you know, or how could you find out? So if anybody wants to share, if you want to take the mic to folks, if you all have experienced that, does anybody want to share about the 4 building blocks within your community? I think she's coming.
So we are not a direct service provider. I work with ICS, and with our Early Childhood Common Agenda, we work with family and community advocates to speak to lawmakers about all the issues we've been talking about yesterday and today. And so when you talked about the civic engagement, and there was another word you used, that immediately came to my mind. We provide a platform for families, caregivers, anyone who works closely with young children and their families to speak to lawmakers in different settings. And I think that does speak to rather than looking at the deficit mindset, looking at the positive attributes. We don't need to wait till a family has, quote, met all their goals. Like, they don't need to be living in a home that they own, working in an office environment and have all their children heading to college before they can start to share their stories. So we provide a lot of opportunities for training for those families, a lot of collaborative support for them so that they can show up at a committee hearing at the State House, or meet one-on-one with a lawmaker, or speak to someone from the press about something that is very meaningful to them and very powerful, without having to, quote, be perfect.
I love that. I think that's beautiful. And thank you for the work that you all are doing. Anybody else want to share something that your community is doing around any of the 4 building blocks? Doesn't have to be all of them, any of them, some of them. It's okay if you don't. So did anybody find anything surprising about the information that we've talked about so far? Because we only have an hour to do this presentation, I went through it kind of quickly because I want to make sure that we have time to answer everybody's questions, that we have time to really talk about anything that didn't make sense or that folks need further clarification on.
I don't know if I would say surprising, but thought-provoking as we address the early childhood workforce and the burnout and compassion fatigue. I think just the power it gives practitioners also to focus on positive child experience and how that affects them and how they can continue to serve is just eye-opening.
Thank you so much. And I agree. That's what I was saying. It was really a heartfelt, joyful experience when I learned that we didn't have to just focus on the adversity, because I work with a lot of trauma survivors. Anybody else? Absolutely.
In a former role, I worked for a school district, coordinating their family liaisons or parent educators. Different people use different terms. And I was at a committee meeting with someone from outside the school district, but who had a leadership level. I won't say what agency or what county, but had a leadership position. And we were talking about family engagement. And he said to me, "Oh, these families just don't care. These families are lazy." And I was like, wow, okay, if you as the head of a program are bringing that belief, like, believe me, your team feels that and the families with whom you're working feel that. And I, took a deep breath before I responded so that I could use appropriate language. I said, well, actually, what I've found in working with families is that even families who are facing really difficult circumstances, a family who may have a family member who's incarcerated, a family member who is struggling with substance use, even the family living in the most difficult circumstances truly loves their child and wants what's best for them. So that's always the approach that I've taken. So I try not to, I wasn't trying to completely squelch him, but can we just open our minds to the idea that every single family wants what's best for their children, and they're doing things to obtain the brightest future that they can for their children with the tools that they have. When we work directly with families, or when we administer programs that work directly with families, and we keep that front and center in our minds, I think that makes all the difference. And the families know it, they feel it. They feel when they're in a space where they are deeply respected and treated with what I call radical dignity, and they step up to the plate and bring their best selves to the game as well.
Thank you. And what I think it's so important, and kind of piggybacks off of what she just said, is we don't know what we don't know until we learn it. So there's no manual that comes with parenting. There's no guidebook, or you can't just find a class. I mean, now you can find a class online for just about anything, but who do you trust? What makes it right? How do we know it's right? So that's important. People know what is passed down from generation to generation. And because this work on positive childhood experiences and adverse childhood experiences, even in relation to how long we've been doing research, cancer research has been going on for much, much longer, and we still don't necessarily have cures for all types. So to think how new this is, relatively speaking, to how long a lot of research has been going on, it's still very new. And it takes a lot of time to really disseminate the information and get it to roll down. So a lot of people are learning about the adverse childhood experiences now, but not necessarily so many the positive childhood experiences. So what I would encourage each of you is to really take this information, and you all will get this slide deck, so feel free to share it with anybody. It's not top secret information. Tufts University wants this information to get out and be shared. Feel free to share it. My business cards are laying over here on the side. If your organization would like to hold a deeper training on hope and all it entails, just give me a call. I'll be happy to help your organization, just because it's worth getting the information out there.
Can I shout out a question?
Sure.
I really love this framework, and which is such a great way, hopeful, as Deborah was saying. Thank you so much. Really appreciate your presentation. Can you give some examples of what this, what you do, what it looks like in practice when you work with an organization? Go through the forms, to give everyone a taste of what are the things you see that you help organizations do?
Yeah, so a lot of forms are just given to people and told, here, fill this out. But it doesn't really come with anything saying, if any of this makes you feel uncomfortable, feel free to leave that out. Or the way we ask questions can sometimes be demeaning, or we've seen a lot of very interesting things with things we've done, and it's just because forms are created to get information a lot of times, and not necessarily to really be hope informed. And then for example, we do some trainings and with just let's say pediatricians, for example, really talking to them about focusing on when a child, say a child comes in with a broken arm. Well, how do you get that kid to really focus on wanting to wear the cast and wanting to do what it is that you need them to do to get their arm healed? Well, if you talk to them about what's important to them, say it's a kid that plays sports, and then talk to them about how it's so important for their arm to heal so that they can continue playing sports, putting things on a level for the children that they can understand and taking time to really focus on what is important to that person or to that family and make it relatable to them is something that surprisingly a lot of organizations don't actually do because they're not trained to do that. And again, we don't know what we don't know until we learn it. And so just working through different things like that and case studies and examples and different things with organizations. Trainings are usually very customized to the organization. So it usually starts with a consult, like where's your organization at? What are they doing? And how can we best implement the 4 building blocks to best serve your organization? Is that helpful at all? Uh-huh. Anybody else have questions?
I think more of a comment. So I am a child life specialist, so I'm actually the person in the hospital who talks to children about what's happening in a developmentally appropriate way, and educates staff in that manner. And the goals of my role are to promote positive psychosocial development within a very stressful environment. And so I just want to make sure I'm understanding like your company correctly and things and your organization correctly. So you also include hospitals within people or within your clientele that you help rephrase things. And I'm thinking like just like pamphlets that they give to families and stuff, you would help inform what information and how they word it and things like that, right?
Yes.
Okay. Do you, and I saw people on your staff earlier, and I saw a lot of research assistants and things. Was I understanding that correctly?
Yes. So that's our National Technical Center.
Okay.
And we, because our organization is specifically Hope Champions, we absolutely have access to all those folks.
Okay.
And yes, that is specifically what we do. So Tufts University passes out the framework, and then there are 40, I think, Hope Champions across the United States, and they allow us the opportunity to work with organizations like you're talking about to become more hope-informed and create pamphlets and different forms and however that looks, whatever it is your organization needs. We do an assessment and an analysis and then begin to work together. And it's a very collaborative thing because we don't know your organization like you know your organization, and we don't know the people you serve like you know the people you serve. So it's a very collaborative effort. But yes, we serve all types of organizations.
You answered my next question too, so thank you.
Anybody else? Comments or questions?
Kind of going back to the very beginning when you were you showed the image, the black and white image in a family's home. Kind of 2 lenses. I looked at that. So being very vulnerable. I am a mom of a 4-year-old and 11-month-old. So at first that image was like, wow, there's a lot going on in that house. And then I was like, that's actually not very different from what my house looks like around 5:45, right? And so there was a parent sitting, possibly decompressing. We're a 2-parent working household, decompressing. Children, yeah, there was a child, in some sort of containment device, but was the child, were they crying or were they playing with an older sibling? There was another child laying, maybe they were decompressing from the day. There was pizza on the table. it's Friday. I'm a mom. I'm not going to say, won't ask my husband if we can go get pizza tonight, right? Does that make me a terrible mom? And so when you said, looking at it from that first lens, like he was like, oh yeah, look, something's unplugged and this and that, it was just like a reaction. But when you do that type 2 thinking, like look at it a little deeper with a little bit more compassion. Like I'm well educated. I'm in the field of early childhood. It's like, that really isn't that far off. You know, our house is chaotic and messy, and that's life. And so being compassionate to our families. But I work with teachers in the early childhood setting, and it made me think about the compassion fatigue that we're seeing and the burnout that we're seeing. And doing an activity with showing an image like this and doing a quick response, and you get that like, oh, look, they're on an iPad, the phone's on, and they get that quick response from teachers. And you can sometimes get those feelings of that parents don't care, or oh, they should turn that off and read a book. And, you know, it's like, guys, it's not real life. We're not going to do that your whole day is not that snapshot. But if we could kind of dig in with teachers and practitioners and say, now let's do some type 2 thinking, you know, sit with this image for 5 minutes. Now let's do a reflection to kind of build some of that compassion and get practitioners back in touch with that piece, because it's not all bad, you know, it's real life. So.
Absolutely. And I think what the HOPE framework really aims to do is to turn some of that, what is now considered type 2 thinking, into more of like type 1 thinking, where that becomes our bias, is to see the positive first. Because like you said, it's so easy to look at a picture and say, oh my gosh, what is going on here? But it's just a picture. And if you really think about it, organizations skew data all the time by only taking a snapshot of a certain segment of the data. If you had the full picture from beginning to end, it may and most likely would look very different than that snippet of information you're getting. So it's much the same when we're looking at one picture of a household like you just shared. And thank you for sharing that, and thank you for your vulnerability, because a lot of times that's very hard, and to be that vulnerable with a big room of people, especially colleagues, that's the reality. It's tough. I don't know if I could have done it sitting there. So I commend you. I have 2 teenagers, and if you're not there yet, oh boy, do you have a future to look forward to. Sorry for anybody that has that coming up. It's been an interesting situation with one that plays sports and one that's into gaming and all of that good stuff. So yeah, that's the reality at our home too. But if you saw everything we do, and the time we run to football, and the time we're going to this club or that club and doing this and doing that, like, well, unless we bring somebody in to clean the house, who's going to do that? Because we're focused on other things. So even while we try to give our children the best lives we can, if somebody wants to look at one specific area of our life, of course, they can find lots of things wrong. They could probably even find things wrong with how I take my children to football, if they wanted to, if they really wanted to dig into it. But again, that's our implicit societal biases. And oftentimes what we've learned from others is, because that's our instinct, is to judge what we see. And that's, everybody has it. I mean, not any of us, I don't think, I mean, maybe there might be one unicorn or so in the room, but I don't think any of us can really say that we don't experience that, at least from time to time. Even our best we can do, we still sometimes see things and think, oh my gosh, you know, or whatever the thought is. So yeah, that was super important, and thank you. Anybody else?
So it's not a question, just kind of, I don't know, messy thinking. So you were talking about the really upsetting comment you heard from a colleague about parents not caring. And, you know, I hear that a lot. I also work in public education, and, you know, it's really hard for teachers to do what they do every day. And, you know, a lot of times they feel like they're not getting, you know, all the help and all the support. And a lot of times they're not. But one thing that, you know, I'm sitting here thinking about is that I feel like so much of the conversation historically has been more of like an us versus them approach, where, you know, that partnership between, you know, the educational setting and then the family setting is just not quite as cohesive and functional as it should be. But COVID and that whole experience, I feel like, for me at least, and I am an empathetic person, and so, you know, I've been preaching a lot of these things for a long time previous to COVID, but COVID really put it into perspective because I am coming from a place of privilege. I have all the resources in the world, and I thought that I was literally going to have a nervous breakdown. And so a conversation that, you know, we've had quite a bit, and that, you know, we just kind of keep revisiting with other colleagues is that, you know, if it was that difficult for us, you know, imagine what that's like times 10 every day, year after year, day after day, and never feeling like you can catch your breath. And so, you know, one of the things that I think that I want to start maybe shifting the conversation to is like thinking about like, well, what got us out of that? Again, we have resources, you know, that are not as available to, you know, a lot of the families that we serve. But I think that, you know, like I said, COVID kind of shifted the perspective and allowed us to kind of see, you know, even for those of us who have, you know, the best of everything, it was a real struggle. And so, you know, just kind of keeping that in mind as we're working with these families.
Yeah.
Yeah, there you go.
I think I was just going to build off that. I'm going to probably just steal an Emmy thought. Have you thought about hope for early childhood professionals? Because we say burnout, burnout, burnout. But like, what about, you know, empowerment? Or how, like, can we do the same thing with, and I don't, does anyone do that? Because I just feel like that's also missing. You know, it's like one thing to provide that training, but when it's a little, I don't know, coming from married to a former kindergarten teacher who left the profession, who's now in social work, another hard career. And a lot of it is like, you know, you hear that, but then it's a little bit, what's the word, ironic, because you hear that you should say that with approach with families when you're not getting it yourself. Does that make sense? And I just hear this all day, so I'm just channeling.
During one of the morning speakers, when he was talking about the knowledge gap versus the skills gap, like it's really easy to address the knowledge gap, and I feel like we do, you know, a pretty good job of that. But you're right, like how does this look, and what does this look like? And I think that we forget, you know, even though they are early childhood professionals, you know, the landscape is very different now, you know, than it was 5-10 years ago, and so, you know, we do kind of, I think, need to rethink, you know, how we're training them and how we're coaching teachers through those very real challenges.
Yeah, and to answer kind of your question, we have done presentations for several school districts, and things to really help educate the teachers about how hope can be beneficial for the students and things, because I think, again, it goes back to we don't know what we don't know. Like if anything that I shared was kind of like aha to any of you, I'm sure it would be to the teachers as well. And, you know, in relation to how can we support the teachers more, we do a lot of resiliency workshops that, and especially we've piloted some of that with our local school. We have a trauma resiliency initiative in our county that our organization is involved with, and we're working with them now to pilot some different things. So hopefully within the next year, I'll have even more that I could share with you about what we're doing. But yeah, I think resiliency workshops for early childhood educators is super, super important, because when you end up with somebody that's totally burned out, I mean, they really have two choices: to either burn themselves out so they just can't go anymore and then they start having physical or mental health issues, or leave the field. So how do we stop it before it gets to that? And I think one of the things we can do is resiliency type things, which is usually focused around somatic practices, breathing techniques. A lot of that is what we've used, and we've had some really positive feedback from it. And I'd be more than happy to talk to any of you folks more, outside of this session about ways that we could help or how that might look. Anybody else have any questions or comments? We just have a few more minutes. There's someone way up there.
Thank you. So that's loud, but outside of the extremes, what deems a positive or an adverse outcome? Because culturally that's different, your experience, and how do you determine, as a professional, if someone's experience was negative, considering that we all bring our own bias, we all bring our own cultures, and what I deem was a positive experience may be very different from what you would deem it.
Yeah, and that's where I think cultural humility really comes in. And, even though I'll never be able to study and know every aspect of every culture, I can certainly ask someone, what is important to you? Does positivity look like for you? And those type things. And that's a great point that you bring up, because just like trauma, no particular event, we can't put our finger on a specific event and say this is a traumatic event, because it's not a particular event, but rather how the brain processes the event. So it's much the same for positive experiences. I can't deem what is or isn't a positive experiences. All I can do is the framework that we just talked about and do things to help build resiliency and to help build more positive environments. So I think the HOPE framework really focuses on the community aspect of things in lieu of each individual home. Does that make sense at all? Is that helpful?
Yeah, it was helpful.
And if you want to send me an email, we can definitely have a deeper conversation about these things. I'm happy to talk to you even more about it. But that's kind of the short answer that I can give you. And the quote I just said about trauma not being a particular experience, that came from Dr. Gabor Mate. And he talks about we need to shift our thought process from what's wrong with you to what happened to you. And I think that's incredibly important. And I think with just those small shifts in our thinking and how we ask or address things can make an impactful difference in our communities. Not making the assumption, which a lot of people do out of the unknowing any differently, well, what's wrong with you? Why are you like that? Well, it's not what's wrong with you, rather what's happened to you that makes you respond that way, kind of thing. Anybody else? Thank you so much for your question.
Just to leave on a positive note, when you talk about community, it makes me think of a geographical community, but we're here from early care and education at the Department of Social Services, and we consider our community to be our network of child care providers all over the state. And one of the initiatives that we have been engaged in is called Be Well, Care Well, which is really about the personnel in the center getting together and under the advisement of a health educator, there's choices that they make to reduce their stress and work together. The director has to be a part of it. And so it's been very beneficial to a lot of centers to do that. And, we've tried to make our standards, because we do evaluate, but we've tried to make our standards very strength-based and positive so that people can look at them from, a strength-based perspective, not, oh, I missed that and I missed that. So I just want you all to know that, we are doing things. And I'm going to pass it on.
Yeah, I was going to talk about Be Well, Care Well, too. We talk about the child care providers because our thought was, how can they take care of babies when they're worried about their lights being turned off at home, So it was a way of getting in there and giving them resources that they need to take care of their well-being for their families so that they can better take care of the babies. So it's been a very successful program. And as you might imagine, with COVID, it's kind of exacerbated things. So we were looking at trying to increase our reach to make sure we can help all. So.
Thank you. I think that's beautiful. Thank you for sharing that. That's amazing. So I think we have time for one more comment. We have about 3 minutes remaining if anybody has anything. I don't want to leave anybody out that has anything. Otherwise, we'll just go through. So basically, HOPE is strength-based, child-centered, family-led, innovating around promoting the access to the 4 building blocks. And HOPE really celebrates the strengths of families. And so I think when we focus on strengths, that also helps us with positivity and positive experiences, in a way of kind of going back to the question you asked about what creates positive experiences. I think if we really celebrate the strengths of people and not focus on the negatives or what might not be going so well, that can also help create an environment to foster more positivity. We've already kind of done questions. So moments of hope, they can happen at all these times, at each encounter, during intake and assessments, when sharing referrals or community resources, creating or revising policies, and when designing programming. And then this, you'll get this also goes to the facilitator questionnaire that Tufts asks for, but I'll send this out to each of you that completed the survey, so you don't really have to worry about this. And then these are some HOPE resources where you can go directly to HOPE and get them. Again, you'll get a copy of this slide deck, but anybody that wants to is more than welcome to take a photo of it. It's just positiveexperience.org /resources. And just really doing these things can help you, help us in the HOPE transformation for America and hopefully globally soon. So thank you so much all for being here and interacting with me during this presentation, and I hope you'll have a wonderful rest of your day and the weekend.